Welcome back to the Ectoparasite series of lecture part 3. In this series of lecture, we will be discussing about fleas. There are 4 types of fleas that are of medical importance for your series of lecture. The first being the human flea. However, this would not be dwelled on in this series of lecture. The second flea, which is the rat flea, this is a very significant flea in the human history, whereby it is the vector for the plague. The third type of flea is the cat flea. This flea is also significant in that it is a vector for flea-borne diseases. And the fourth type of flea is the shigo flea. All the fleas, whether they are male or female, feed on human blood. The shape of the flea, they are generally flattened laterally. The morphology of all the mites mentioned below is similar. The first type of flea, the human flea, is less commonly seen nowadays. The rat flea is a primary vector for the bacteria Yersinia pestis, which causes the disease, the plague. It is also a vector for Rickettsia typhi, bringing about the disease of flea-borne murine typhus. You can look through the websites shown here to get more details of these fleas. The third type of flea is a cat flea. Now, this flea is an intermediate host for several types of cestodes. The cat flea is also a vector for bacteria which can cause cat scratch disease and flea-borne spotted fever or feline rickettsia. And the last type of flea is the shigo flea. It is not a vector, and however it can cause quite debilitating skin lesions. The first type of flea that we will be discussing is the rat flea. For the purpose of your exams, you need to be able to say the full name of the organism, and you can bracket the general name of the organism. What you see on this slide is the rat flea. The appearance of the rat flea and the cat flea is very similar. For the purpose of your exams, when I give you this diagram, you may describe it as a cat flea or the rat flea. However, your description of the diagram has to fit in the exam questions given to you. The rat flea can be found throughout the world, and the transmission of flea is from rat to man, as the name would suggest. As mentioned earlier, the shape of the flea is laterally flattened. So if you were to put your palm facing laterally, that is how the general morphology is for the flea. This is the common sign and symptoms of a person that is being bitten by a flea. You'd expect a rash to appear in a cluster. It will be quite itchy, and there might be vesicles present at the site of the bite. Now, what is significant about the rat flea is that it is a vector for Yersinia pestis. Yersinia pestis is the bacteria that is responsible for the bubonic plague. Now, what happens is the rat flea becomes infected with the bacteria after the flea has taken a blood meal from another infected animal. The infected flea then bites the man. When the infected flea defecates onto human being, the poop or the fecal matter is contaminated with the bacteria. When the contaminated feces is forced or massaged into the wound, the bacteria enters the man. Hence, bubonic plague can take place. This is an infographic of how the rat bubonic plague take place. The normal cycle of the flea is within the animal kingdom itself. However, when the flea within the animal is being transferred to the domestic animal, or even to the directly to human being, that is how man can be infected from the infected flea. This is the general life cycle of the rat flea, the cat flea, the dog flea, and the human flea. Between the egg, the larva, and the pupa, all this exists in the environment. When the pupa hatches, or when the pupa is matured, the adult flea is being released. The adult flea will then look for a suitable host for the flea to have its blood meal. Please read through the life cycle of the fleas, and this is taken from the CDC website. This is an infographic about flea-borne typhus. Now, flea-borne typhus is caused by the bacteria Rickettsia typhi. Now, where does Rickettsia typhi come from? It requires a vector, and this bacteria has two vectors. The rat flea is a vector for it, so is the cat flea. So the rat flea along with the cat flea acts as a vector for the bacteria Rickettsia typhi, giving rise to the disease called flea-borne typhus. How do you diagnose flea bites, and what about the flea-borne disease? So first and foremost, you need to look at the signs and symptoms related to a flea bite. So you need to look at is there an itch? Is there a cluster of vesicles? You also need to take a close history of the pets, whether there are any pets around the house, or is the person exposed to any pets recently. You need to take a history about precarious outdoor activity, which puts the patient at risk of being exposed to some animals or an area where there are lots of fleas. And of course, with regards to flea-borne disease, these are bacterial infection, so there are specific diagnostic tests for these bacterial infection. What about treatment? There are two components here, which is the flea bite and the flea-borne disease. With regards to just a simple flea bite, generally there are no treatments. However, that you can prescribe the patients some form of topical antihistamines. However, if your patient have any form of the flea-borne diseases, which is a bacterial infection, therefore specific antibodies needs to be given to the respective bacteria due to vector-borne infection. Lastly, how do you control flea bites? Of course, you need to remove the offending agent, which is the flea. So you need to keep your environment clean by vacuuming your house, washing the clothes and bedding. If pets seem to be the source of your fleas, so you need to be able to remove the fleas from the pets via giving them an anti-flea shampoo. Again, if the flea is from rats, You got to make sure that the surrounding area is clean, so that there is no food and the habitat is not conducive for rats. What you see here are small red bumps, which are the common patterns of rash that you see from a flea bite. The common location for a flea bite is generally the legs or the ankle, because they are low on the ground, which makes it an easy location for the fleas to bite them. These vesicles remain small and they appear either in a cluster or they can appear in a straight line. The surrounding area of this rash can be very itchy. As a result of severe scratching, there can be secondary bacterial infection on the site. In this slide, you can see the flea bite pattern. This is a straight line of the flea bite near the armpit. This is how the flea looks like when it's biting or having a blood meal. And this is the foot, and this is the flea bite pattern. Presumably, this area is covered by footwear and this area is exposed above the socks line. The next flea that we'll be talking about is the shigo flea. The shigo flea is not a vector for any bacteria. However, it can result in disfiguring, debilitating skin lesions. This is how the shigo flea looks like. Again, it is laterally flattened. This is another image of the shigo flea. The shigo flea can be found in the tropics and the subtropics region. It cannot be found here in Asia. Both the male and female flea feeds on the blood, on the human blood. However, only the female flea burrows under the skin. This is a picture of a immature female flea with no eggs in her. This, however, is a gravid female flea. If you can appreciate that this is the head and this is her rear end, and this is a distended mid-region with eggs in it. This is just another diagrammatic representation. So the infestation of this flea is called tungiasis. At the skin lesions, again, secondary bacterial infection can take place. What do you do with it? You need to remove the gravid female from the skin lesion in order to treat the infestation. This is the general life cycle of the shigo flea. The eggs, the larva, and the pupae happens in the external environment. The pupae will mature, and from the pupae, the adult flea would hatch. The adult flea would need to feed on human blood. So the flea would then look for a human host and bites the human host. The male and female flea can be found on the human host. However, only a fertilized female flea, which is this, will burrow herself under the skin. So this is the human skin, surface of the skin. This is the head of the female flea, and this is the rear end or the tail of the flea. In this distended abdomen is where the gravid or the eggs can be found. Later on, the eggs will be released onto the skin. Please read through the life cycle of the shigo flea. This is taken from the CDC website. In this slide here, you can see a male flea and a female flea. When the male and female flea mates, the female flea would be fertilized. A fertilized female flea would then burrow her way under the skin. With time, the midsection of her abdomen will grow. So this diagram is represented here. This is the head, this is the head, this is the tail, and this is the tail. From this stage of development, the midsection of the abdomen will grow even larger with mature eggs. What happens next is, in this diagram, this is the skin surface of the human host. This is the tail end of the flea, and these little dots you see over here are the eggs that have been expelled from the full abdomen. What you see here is the clinical presentation of the skin lesion as a result of tungiasis. How do you treat it? You need to surgically remove the female flea from the skin lesions. This is the end of your Part 3 Ectoparasite series of lecture. From your Part 3, you were exposed to 4 types of fleas. Very briefly, the human flea, and then you were exposed to the rat flea, cat flea, and the shigo flea. From the 4 of these fleas, the rat flea and the cat flea are vectors to some bacteria that can cause significant impact onto human lives.